Avoid baking soda if you have these 5 health conditions. Most people think of baking soda as a harmless kitchen ingredient, but did you know that it may actually be dangerous for some people? In fact, if you have certain health conditions, consuming baking soda could put your body at serious risk. In this video, I will tell you about 5 serious health conditions where baking soda may make things worse instead of better. Be sure to watch till the end, and always consult a healthcare professional before using baking soda for health purposes. Now, let's get started. When people should avoid baking soda. 1. Hypertension, high blood pressure. High blood pressure means your heart and arteries are already working harder than they should, and adding extra sodium into the mix may push them to dangerous levels. The moment baking soda enters your system, your body reacts to its high sodium content, and that sets off a chain reaction that may make hypertension worse. Sodium is one of the biggest culprits behind high blood pressure, and baking soda is loaded with it. When you consume it, your body quickly absorbs the sodium into your bloodstream, increasing the amount of fluid in your blood vessels. The more fluid in your blood, the higher the pressure inside your arteries. Your heart has to pump harder to move this extra volume, and over time, this strain may weaken your heart muscles and damage your arteries. The blood vessels lose their flexibility, making it even harder for blood to flow smoothly, which raises the risk of heart disease and stroke. According to research, high sodium intake contributes to hypertension by increasing water retention, vascular resistance, and arterial stiffness. Reducing dietary sodium lowers blood pressure in both hypertensive and normotensive individuals and is linked to reduced cardiovascular disease risk. Baking soda also changes the way your blood vessels react to pressure. Normally, your arteries expand and contract to adjust to changes in blood flow. But too much sodium may disrupt this process, making the blood vessels stiff and less responsive. This puts additional pressure on your circulatory system, forcing your heart to pump harder just to keep blood moving. Over time, this may lead to long-term damage, increasing the risk of serious complications like heart failure or stroke. 2. Kidney disease. If you have kidney disease, consuming baking soda could be far more harmful than you might think. Normally, your kidneys regulate pH by removing excess acid or bicarbonate, keeping your blood at the right level of acidity. But when you have kidney disease, this system is already impaired. Baking soda, being a strong alkaline compound, forces the kidneys to adjust even more, pushing them to excrete excess bicarbonate or retain too much. This unnatural shift may lead to metabolic alkalosis, a condition where your blood becomes too alkaline. It may lead to confusion, muscle twitching, nausea, and in severe cases, irregular heart rhythms. When the body can't correct this imbalance, it may create a dangerous situation that puts extra stress on multiple organs. Sodium content is another major concern. Since baking soda is essentially sodium bicarbonate, every time you consume it, you're introducing more sodium into your bloodstream. Kidneys are responsible for filtering out excess sodium, but in kidney disease, they struggle to do this efficiently. As sodium builds up, it leads to fluid retention, which may cause swelling in the legs, hands, and even around the lungs. This extra fluid doesn't just cause discomfort, it increases blood pressure, making kidney function deteriorate even faster. The more sodium in your body, the harder your kidneys have to work, and when they can't keep up, it creates a vicious cycle that accelerates kidney failure. A 28-week study published in PubMed found that a higher dosage of baking soda slightly raised albumin excretion in the urine. 3. Digestive disorders. Your stomach produces hydrochloric acid to break down food, absorb nutrients, and kill harmful bacteria. When you consume baking soda, it neutralizes that acid almost instantly, which might seem like a relief at first. But here's the catch. Your stomach senses the sudden drop in acidity and responds by producing even more acid to compensate. This process, known as acid rebound, may leave you trapped in a cycle where you're constantly dealing with worsening heartburn and discomfort. Over time, this may erode the esophagus, making acid reflux even harder to manage and increasing the risk of long-term damage. One more thing to think about is how baking soda affects the stomach's ability to make gas. When sodium bicarbonate meets stomach acid, it creates carbon dioxide gas as a byproduct. This leads to bloating, belching, and that uncomfortable, swollen feeling in your gut. If you already struggle with IBS, this reaction may trigger painful cramps, excessive gas, and unpredictable digestive flare-ups. The extra gas buildup puts pressure on the stomach, which may also force acid back up into the esophagus, making acid reflux symptoms even worse. Instead of providing lasting relief, baking soda may create a new set of digestive problems that are difficult to control. Additionally, in extremely rare instances, gastric rupture may result from consuming too much baking soda, as reported in the BMC journal. 4. Edema and heart failure. If you have edema or heart failure, even a small amount of baking soda may put extra strain on your body in ways you might not expect. It may seem harmless, but what it does inside your system may quietly make things worse. Your heart and kidneys work together to maintain fluid balance, and when one is already struggling, anything that disrupts that balance may lead to dangerous complications. Sodium is one of the biggest concerns when it comes to heart failure and edema. Baking soda is essentially sodium bicarbonate, which means that every time you consume it, you're adding more sodium into your system. Sodium causes your body to retain water, which increases the volume of fluid in your blood vessels. This puts extra pressure on your heart, forcing it to work harder to pump blood throughout your body. If your heart is already weakened due to heart failure, this additional strain may make symptoms worse, leading to increased shortness of breath, swelling in the legs and feet, and a higher risk of complications like fluid buildup in the lungs. Over time, excess sodium makes it harder for your heart to keep up, potentially leading to worsening heart failure and hospitalizations. According to research, some trials suggest that sodium restriction in heart failure may cause harm by leading to hypokalemia and increased neurohormonal activation. The alkalizing effect of baking soda is another factor that may create unexpected issues. While it's often used to neutralize stomach acid, this shift in pH may interfere with normal muscle and nerve function, including how your heart contracts. Your body relies on a precise balance of electrolytes, including sodium, potassium, and calcium, to keep your heart rhythm steady. Too much alkalinity may disrupt this balance, potentially leading to irregular heartbeats, muscle weakness, and increased fatigue. If your heart is already weakened, even minor changes in electrolyte levels may have a big impact, making heart function less efficient and increasing the risk of arrhythmias. 5. Hypokalemia, low potassium levels. If you have low potassium levels, also known as hypokalemia, consuming baking soda may quietly make things much worse. Sodium is a key reason why baking soda may be dangerous for those with hypokalemia. Since it is made up of sodium bicarbonate, every time you consume it, you're increasing the sodium levels in your bloodstream. Your body naturally balances sodium and potassium, but when sodium intake rises, potassium gets pushed out of your cells to compensate. This leads to even lower potassium levels, which may trigger muscle weakness, fatigue, and in severe cases, dangerous heart rhythm disturbances. For someone already struggling with hypokalemia, even a small shift in this balance may make symptoms worse and put additional strain on the heart. The kidneys play a big role in regulating potassium, and baking soda may interfere with this process. Your kidneys filter out excess potassium through urine, but when baking soda is introduced, it increases the rate at which potassium is lost. This happens because baking soda alters the pH of your blood, causing the kidneys to excrete more potassium to restore balance. Over time, this continuous loss may make hypokalemia even harder to control, leading to symptoms like muscle cramps, irregular heartbeats, and overall weakness. If potassium levels drop too low, it may even increase the risk of paralysis or life-threatening arrhythmias, where the heart beats in an abnormal rhythm. According to PubMed, excessive sodium bicarbonate consumption during pregnancy caused severe hypokalemic metabolic alkalosis, which resolved after discontinuation. Now that you know when to avoid baking soda, let's discuss some of the amazing health benefits of baking soda. 1. Help soothe urinary tract discomfort. Normally, your urine has a slightly acidic pH, which helps keep harmful bacteria in check. However, when an infection or irritation occurs, acidic urine may cause more burning and discomfort while urinating. Baking soda, being alkaline, temporarily raises the pH of urine, making it less acidic. This shift may reduce the sharp, stinging sensation that happens when urine passes over inflamed tissue in the urinary tract. By neutralizing excess acid, it creates a gentler environment that may make it easier and less painful to urinate. Baking soda may also have a mild impact on bacterial activity inside the urinary tract. While it doesn't directly kill bacteria like antibiotics, its alkalizing effect may make the urinary environment less hospitable for certain types of bacteria that thrive in acidic conditions. By temporarily shifting the pH balance, it may slow down bacterial growth and give the body more time to flush out the infection naturally. This is not a substitute for medical treatment, but in combination with increased water intake and proper care, it may provide some relief while the body fights off the infection. According to PubMed, oral sodium bicarbonate improved overactive bladder symptoms, reducing frequency, nocturia, urgency, and urge incontinence in female patients over 4 weeks. 2. Supports oral health by reducing bacteria and plaque. Baking soda has been used in dental care for years, and there's a good reason why many toothpaste brands include it in their formulas. Every time you eat or drink, especially sugary or acidic foods, the pH balance in your mouth shifts, creating an environment where harmful bacteria may thrive. These bacteria produce acids that weaken tooth enamel, leading to cavities and sensitivity. Baking soda, being alkaline, helps counteract these acids and bring the pH of your mouth back to a safer level. This not only protects the enamel but also makes it harder for bacteria to multiply, reducing the risk of decay and long-term dental issues. By maintaining a balanced pH, baking soda plays a key role in keeping your teeth strong and healthy. Its natural ability to get rid of plaque and surface stains is another big benefit. Unlike some harsh whitening treatments that may wear down enamel over time, baking soda is a mild abrasive that gently polishes the teeth without causing damage. When used in toothpaste or as part of a homemade rinse, it helps break down the sticky film of plaque that builds up on the surface of your teeth. Plaque is a major cause of gum disease and tooth decay, and if it's not removed, it may harden into tartar, which is much harder to clean. Baking soda's fine particles help lift away this buildup, leaving teeth feeling cleaner and looking brighter without the risk of excessive wear. According to research, toothbrushing with a baking soda dentifrice significantly reduced plaque and gingival bleeding compared to both negative and positive control dentifrices. 3. Enhances athletic performance by reducing fatigue. If you're looking for a natural way to push your endurance and delay muscle fatigue during workouts, baking soda might be the secret weapon you haven't considered. Athletes and fitness enthusiasts have been using it as a performance booster for years, thanks to its ability to help muscles work harder for longer. One way baking soda supports performance is through its effect on oxygen utilization and energy production. During strenuous exercise, your body relies on efficient oxygen delivery to fuel the muscles and sustain movement. When acidity in the bloodstream rises, it may interfere with how oxygen is transported and used by the body. Since baking soda helps stabilize pH levels, it creates an environment where oxygen is more readily available for muscle cells. This leads to better endurance, improved stamina, and an overall boost in workout efficiency. Athletes who engage in sprinting, cycling, or interval training may especially benefit from this effect, as it helps them maintain explosive movements without feeling drained too soon. The Journal of Sports Science and Medicine reports that baking soda has shown the ability to improve performance. Athletes participating in activities like swimming and cycling have reported improvements of up to 3% when using baking soda. 4. Helps soothe skin irritations and sunburns. If you've ever dealt with itchy skin, bug bites, or sunburn, you know how frustrating it may be to find relief. The skin has a natural barrier that relies on a slightly acidic pH to stay healthy and fight off bacteria. But when irritation occurs, whether from a rash, insect bite, or allergic reaction, this balance may be disrupted, leading to increased sensitivity and inflammation. Baking soda, being mildly alkaline, works to neutralize excess acidity on the skin's surface, helping to restore balance. This may reduce the stinging or burning sensation caused by irritants while making the skin feel calmer and less reactive. Applying a paste made with baking soda and water or soaking in a baking soda bath may create an environment that allows the skin to recover more comfortably. Furthermore, baking soda helps through its mild anti-inflammatory properties, which reduce redness and swelling. When the skin reacts to an allergen, bug bite, or sunburn, the body sends inflammatory signals to the area, causing swelling, heat, and irritation. Baking soda may help counteract this response by drawing out excess fluid and calming the skin's overactive reaction. This is especially useful for people with sensitive skin who experience frequent flare-ups or discomfort from minor irritations. A gentle application of baking soda may help tone down the inflammation, providing noticeable relief from itching and discomfort without the need for harsh chemicals. Researchers tested 70 different fungal strains responsible for skin and nail infections in a PubMed study that explored the antifungal properties of sodium bicarbonate. Inhibited 80% of these strains. 5. Aids in muscle recovery after exercise. While proper nutrition and rest play a big role, baking soda is an underrated tool that may help speed up the recovery process. It works by reducing acid buildup in the muscles, improving circulation to flush out waste, and minimizing post-workout inflammation. These benefits make it a simple yet effective way to help your body bounce back faster, so you may get back to training without lingering soreness or fatigue. One of the key ways baking soda supports muscle recovery is by neutralizing excess lactic acid that builds up during exercise. When you push your muscles hard, they produce lactic acid as a byproduct of energy production. This acid buildup is one of the main reasons for that burning sensation during workouts and the stiffness that follows. Baking soda, being an alkaline compound, helps buffer this acidity, restoring a more balanced pH in the muscles. By reducing the level of acidity, it allows muscles to recover more efficiently, decreasing soreness and stiffness after intense training. This makes it especially helpful for endurance athletes or anyone engaging in high-intensity interval training. Moreover, during exercise, muscle cells generate waste products like carbon dioxide and hydrogen ions, which may contribute to soreness and fatigue if they aren't cleared out quickly. Baking soda improves circulation and helps the body remove these waste products more efficiently. When the blood is less acidic, oxygen delivery to muscle tissues improves, allowing the body to transport nutrients to fatigued muscles while flushing out waste. This means less cramping, faster repair of micro tears in muscle fibers, and a reduced feeling of heaviness after a tough workout. A study in the Journal of the International Society of Sports Nutrition suggests that eating baking soda before working out might help your muscles recover by removing the lactic acid that builds up during intense workouts. While baking soda has many practical uses, it may not be suitable for you or me. If you have hypertension, kidney disease, digestive disorders, heart conditions, or electrolyte imbalances, you need to be extra cautious. Its high sodium content and alkalizing effects may throw off your body's natural balance, making existing health issues even worse. Before you or I consider using baking soda for any medicinal purpose, it's always best to consult a healthcare professional to avoid any unexpected complications. Now that we have discussed the many health conditions when you should avoid baking soda, let's talk about some other topics of interest. Interested in knowing more about health secrets? Watch 11 powerful brain foods that may help fight dementia. You may also try our video on 10 top superfoods to increase blood flow and circulation. Go ahead, click one. Or better yet, watch both and learn more about your body. How frequently do you have baking soda? Let us know in the comments below.